At least a dozen mask sellers say they have no plans to slash prices of face masks, or they believe demand will still be there, even if it slows. Most were already expecting mask requirements to end sometime this year, with one manufacturer cutting inventories by about 40% in the past 6 months. Chloe Chu tells us more.
At the start of the COVID-19 pandemic, the face mask was the world's most coveted commodity. Shelves were lined with boxes like these, and supplies were flying off the racks. But what happens when restrictions ease and masks are no longer required in most settings? Well, shops selling such masks feel that the pandemic has changed people's attitudes towards mask wearing. They believe that while overall sales are bound to take a hit, demand will continue to linger. Value Dollars says people will still need to buy masks for taking public transport or visiting healthcare facilities. It also believes that some will continue to choose to don a mask while out and about. It notes that travellers heading to some of Singapore's neighbouring countries will require masks, as some of these countries have yet to lift their mandatory mask rules. One manufacturer says it will not slash prices of its masks despite the fall in demand, as margins are already very thin. It says last-minute promotions could also be misconstrued.
Prices, of course, will be very much under pressure. The retailers, especially on those neighborhood shops, they will try very much to offload their stocks. Everyone will try to offload ASAP or whichever is it. But this is also giving a wrong signal because the COVID variant is still not stopped there.
Mr. Ong plans to sell off his current stocks, but he cautions that manufacturers going out of business could affect Singapore's preparedness for the next pandemic. Still, an infectious diseases specialist says it's time mask-wearing rules are lifted, and he believes the decision is a safe one.
We are also a very highly vaccinated population, and even in those who are immunocompromised who do not respond well to vaccination, there are things like pre-exposure prophylaxis, which is giving passive antibodies to protect these people. And we know that most people have the illness in a very mild manner and recovering mostly at home, and hence not putting an undue burden on healthcare institutions.
But Dr. Low stresses that keeping a mask on in certain settings, like where people are densely packed or are unwell, is still needed.